psychedelics-assisted therapy. So some of these psychedelics are not under international control, like ketamine, for example, but some of these substances, most of these substances which are used are under the control of the international drug control treaties. And this, of course, always opens the question, so is it possible under these treaties? Is it allowed for governments to authorize the use of these substances? And if yes, so under which conditions? So this is the question, and this is also I was asked to deliver my presentation on this topic. Simply from the legal point of view, simply from the point of view of international drug control treaties. Immediately in the beginning, the answer, yes, it is possible. If your government decides that it wishes to use psychedelics under control of the 1971 Convention on Psychotropic Substances for medical use in your country, yes, it is possible to do that. So this is possible. And however, there are some conditions in the convention. And of course, governments want to comply with the international law. So your government will probably endeavor to implement these control provisions. The 1971 Convention controls a very high number of substances, and they are divided in 4 schedules. And substances like MDMA or LSD, DMT, psilocybin, they are included in the so-called Schedule 1. And sometimes people hear that this is the schedule of the prohibited substances. So let us have a look at it, how it is in reality, what really the convention says about these substances. So basically, the 1971 Convention stipulates that controlled substances controlled under this treaty, should be used for medical or scientific purposes. Should not be used for recreational purposes, but should be used for medical and scientific purposes. And this is stipulated in so-called Article 5 of this 1971 Convention. However, in this article, it is also stated that with respect to substances which are included in Schedule 1 of that convention, that some stricter control provisions apply, and these control provisions are included in Article 7 of that convention. So I will try to... Okay, very good. So there is an Article 7 of that convention, and it's entitled Special Provisions Regarding Substances in Schedule 1. And it is stated there, and you can read it now on the slide, that in respect of substances in Schedule 1 of the 1971 Convention, the parties shall, item A, prohibit all use except for scientific and very limited medical purposes by duly authorized persons in medical establishments which are directly under the control of the governments or specifically approved by them. So we can read in the slide the text of the 1971 Convention, and you can see here that it is the obligation of governments to prohibit all use of these substances except for, and now scientific, and very limited medical purposes. So what are some special terms used in this Article 7? One of these terms is very limited medical purposes. Another term which would need some clarification is by duly authorized persons. And the third is in medical establishments directly under the control of governments or specifically approved by them. So these are some special terms, and of course, if we read it, we do not immediately understand what the convention wants to say, what the convention required. First, what does it mean, for example, very limited medical purposes? What does it mean, these very limited medical purposes? Well, if we want to interpret a convention, usually the first instrument which we are using is a so-called commentary on the international treaties. Commentary is a document which is produced by the Secretariat of the United Nations for the new conventions, and it is usually written by people who were present in the convention, in this case, is more than 50 years ago, and who are then following the records of the proceedings of that discussions leading to the conclusion of the convention, and they want to explain what the governments meant by these terms which they put in the convention. So this helped us. The commentary helped us, and of course, when then your authorities will be preparing, for example, your national legislation for this, modify your present legislation, they can always use as a tool for clarification of these terms, they can use this commentary. Now, please put the slide 2 on the screen. Very limited medical purposes. Yes. So very limited medical purposes. This is the first, and we will try to explain what does it mean. So if we look into the commentary of the convention, so it means that basically these very limited medical purposes means that the substances should be used for those medical indications for which a substance not listed in Schedule 1 and having at least equally effective properties is not available. In other words, if you have a less controlled substance for that indication, then you should use that substance. If you, however, do not have any substance less regulated than substances in Schedule 1 of the 71 Convention, which could be used for the treatment, then as a last resort, you can use the substance in Schedule 1 of the 1971 Convention. So you know that, for example, the Czech Republic adopted last year as one of the first in Europe, as one of the first countries in Europe, some regulations regarding treatment with psilocybin. And the Czechs, in their government order, which was used in December of last year and which is now in force as of the beginning of this year, they indicate for which medical indications psilocybin may be used in the Czech Republic. And it is clearly said that it is only possible when registered medical preparations are not effective for this problem, for this disorder. So you do not have any registered medical preparations which would be helpful. And only then you can go into the use of psilocybin in the case of the Czech Republic. Now, medical doctors will be speaking later, and you all are not new to this area, so you know very well that, for example, for depression, there is a very high percentage of people who will not be helped by registered preparations. Many dozens of percents of those who are suffering from depression, this will be a treatment-resistant depression. And of course, in such cases, when there is no registered medical preparation which could help the patients, then it is possible to apply the substance from Schedule 1 of the 1971 Convention. So now I think we can a bit better understand what the convention means under these very, very limited medical purposes. It might be hundreds of thousands of people. You know, it's not that the number of these people is very limited. Not. It may refer to many patients, but it is something for which registered, less controlled medical preparations are not available. This is like a requirement of the treaty. Now, the second point here is by duly authorized persons. Again, what does this convention mean under the term by duly authorized persons? Who are these persons? Explanation would be that this should not be any medical practitioner. It should not be any medical practitioner. Normally, if you would speak about the prescription of benzodiazepines, for example, so any medical doctor, in some countries, nurse, could prescribe. In the case of the substances in Schedule 1 of the 1971 convention, this should not be any medical doctor. It should be some person with a additional authorization. Now, in the commentary on the convention, we would find that the method by which that restriction is carried out might be different in different countries. So the method by which the restriction of medical doctors who can apply in medical treatment these substances, this method of their restriction might be different in different countries. So in some countries, this restriction is done in that way that these doctors who will be using these substances, prescribing these substances, delivering these substances, will have to receive individual permission from, for example, Ministry of Health. So this is one possibility, and I understand that, for example, in Australia, this is like this. For the use of MDMA or psilocybin, there must be individual authorization of a doctor to use in medical practice the substance. The Czech authorities, for example, in their regulations, which I have just mentioned, the Czech authorities are using another way how to limit this number of medical practitioners. And this is done by the requirements in their government order regarding the qualifications of these medical doctors. So the Czechs identified in the government order, which was issued in December last year, who are the medical doctors who can prescribe psilocybin. And this might be psychiatrists, but with some special additional education regarding the use of psychedelics, or this might be medical doctors who specialize in medical psychotherapy, but these people require specific postgraduate education. So the Czech government order is specifying what are the requirements of the qualifications for these medical doctors who will be allowed to prescribe and then to deliver the treatment, which in the Czech case with psilocybin. So we already know two of these items clarified. We know already what means very limited medical purposes. We have an idea who might be the duly authorized persons. And then the third requirement is in medical establishments directly under control of governments or specifically approved by them. First of all, let us explain the term establishment. It must be some kind of medical establishment. In other words, it should not be, the substance should not be administered by doctors on house calls. It should not be administered in the house of the patient. It should be in some kind of medical establishments. And these medical establishments should be under control of government or specifically approved by the government. So in the case of the Czech Republic, it's normally done in the university hospitals, in university clinics, which are under direct control of government, or in psychiatric treatment centers under direct control of governments. In case another establishment would like also to use psychedelics, that establishment not under direct control government would have to apply with the Ministry of Health and would have to be specifically authorized, specifically approved by the government. So the Czechs, in their government order, they endeavored to implement these requirements of the treaty, and they implemented also this requirement. So please give me the third slide.
Yeah, we see the third slide now.
We see the third slide. Very good. Now I can go a bit more quickly. So then of course all the activities, the convention requires that they are under special authorization. So governments, for example, should require that manufacture of these substances, trade, distribution should be under special license. So if you would, for example, distribute in the country substances for this treatment, like a wholesaler or like a retailer, you should have a license which would specifically mention that you are authorized by your competent authority to distribute these psychedelic substances like psilocybin, for example, or MDMA. So that should be specifically mentioned. And it is also mentioned that this activity should be carried out under close supervision of the government. Everything should be under close supervision. Of course, there should be inspections. The commentary to the convention explained that the inspection should be more frequent than with respect to other psychotropic substances. It is expected that psychedelics will be controlled more strictly. And then also there is a requirement like restrict the amount supplied to duly authorized persons to the quantity required for authorized purposes. Well, the Czechs have quite, and I think you can, if you are interested, you can find on the internet the government order. It's government order 552/2025. Issued by the governments of the Czech Republic on the 10th of December 2025. And it's a government order about the conditions for prescription, delivery, and use of individually prepared medical preparations containing psilocybin for medical purposes. So you will find there, for example, that the Czechs put into their medical order even some quantitative restrictions. So, for example, the consumption of psilocybin by a patient should not exceed 75 milligrams of psilocybin per month. So not more than 75 milligrams are allowed to be prescribed. During one treatment session, maximum of 35 milligrams of psilocybin can be prescribed. There might be intervals between different treatment periods, at least of 7 days. And it is also stated in the government order, if there will be no important improvement in the condition of the patient after 3 sessions in which psilocybin will be delivered to the patient, then if there will be no progress after these 3 sessions, the further use of psilocybin should be discontinued. And there are some other conditions there. For example, how one session should be supervised, one session in which psilocybin is delivered. There is a need for supervision of at least 4 hours. If a larger quantity is used, 6 hours, etc. And normally 2 people, 2 medical practitioners must be present with that patient. So very strict requirements. And if we're going behind what is specifically mentioned in the convention. Please go to my last slide.
Yeah, we see it.
Thank you very much. So require records. I think the convention says that about these activities, the doctors should keep records for at least 2 years. In the Czech Republic, in their government order, they even put the period of 10 years for keeping of records. And the final comment is that export-import should also be under special export-import authorizations. So as you can see, there are some stricter control requirements for the medical use of psychedelics included in Scale 1 of the 71 Convention than are the control requirements for the use of other psychotropic substances. But I think one of the speakers before me already mentioned the objective of this treaties, International Drug Control Treaties, and also of the 1971 Convention, is not to prevent medical use of these substances. No, these substances, when needed, and when no other better substances are available, these substances should be made available to people, and governments should find a way how make them available to patients. So I think the answer is definitely the use of psychedelics controlled under international drug control treaties for medical purposes is allowed. This is in line with the treaty. You have to apply with some control provisions of the convention, and some governments have already done so. So you have good examples which you can use. At this moment, I would finish. I would like to thank you. I would like to thank you also for this honor to be with you. In fact, I know that the delegation from the Czech Republic was in your country and was presenting the Czech system, and I was connected via Zoom to one of the sessions, so I hope it's not too much for some of you that you are not hearing us for the second or third time, but anyway, we are at your disposal, and it's your for the use of your people. So thank you for your attention, and I will be waiting for possible questions. Thank you.